Good evening, everyone. I'm Khushbu, and this is my colleague, Miss Nehal. We welcome you all for this presentation today, and thank you for attending the presentation. We both are pediatric physical therapists, and we work in the early intervention department as senior therapist at Hope AMC Dubai. In a field of expertise, we provide multidisciplinary service to children from day zero of life, preterm and premature infants, high risk infants, children born with any syndrome or acquired any brain damage during birth. Today, we will be highlighting information on identification of early signs and potential benefits of early screening using a very potent tool that is general movement assessment and how early markers or identification help us identify possible risk of delayed development and how early therapy can help bridge this gap. So broadly, we will be focusing on the age group that qualify for the screening, insights on general movement assessment, key observation checklist, insights on neurodevelopment, and few success stories. So the children that qualify for this screening are any children that are born premature, that is between 34 to 36 weeks, or any preterm baby born between 36 and 40 weeks, or postterm baby after 40 weeks. Babies born with low birth weight, infants with low UPGAR scores, infants who are born to mothers who may have experienced any antenatal complications like diabetes, pregnancy-induced hypertension, or during delivery may experience prolonged labor, or the child went in respiratory distress or hypoxia at birth, like the child did not cry immediately after birth, or infants who are already born with any pre-existing conditions like congenital heart disorders or Down syndrome or intrauterine growth retardations. So, my colleague, Ms. Nehal, would be explaining us about general movement assessment. Uh, Over to you, Nehal. Thank you.
Good evening, everybody. I hope I'm audible to everyone of you all. Thank you, Khushbu. Thank you for the introduction. Let me make this kind of an interactive thing between everyone. When I say that, when we flashed onto the slide where we showed you the high risk infants, okay, let me go back to that slide. How many of you as parents or somebody who knows a child, how many of you did that mental marking that, yes, does my child fit into this? Does it tick anything? Does it show me anything that, my child showed or a child that I know showed? Obviously, everybody would have done that. We would do that mental markup because risk and high risk are those words where we would not want to infiltrate, right? And I actually understand you. I get you when you do that. While I say that I get you when you do that, I would say that, that is where I stress that, every child is precious. My child, be it if he falls under this category or no, he is precious. She is precious to me. Everybody knows that right now, in this day and age, pregnancy itself is so precious, let alone that having a child and the entire journey of parenthood is also an experience which is so precious. Would you not want to do anything and everything for your child? I suppose the answer is universal. Yes, you would. We would. Everyone would. Okay. Now, going by the fact that, we're not here to scare you or something, I want to highlight that we are here to be the guiding hand. Okay. Uh, Having had the experience of over 10 years in pediatric physiotherapy, I understood that, what I have been through in my journey as a pediatric therapist, I would always want to pick up signs early on. I've always had, and my fellow pediatric therapists would also have this thing that, I would, I would be very happy, or I wish I had seen this child earlier. This is something I would have seen, and I see myself saying a couple of times. Okay. Now, how do I mean? What do I mean when I say? Okay. I say that, I am trained to do something with general movement assessment. I'm trained to do something which catches on the high risk things earlier. Okay. Now, let me introduce you to the concept of GM. First and foremost, let me take you back to the journey of pregnancy. Did your doctor do the ultrasonics periodically to test on certain things like growth of the child, and also isn't that one other thing that the your gynecologist actually saw was, is the child moving well? So I want to emphasize that if movement as a marker is something that we have been periodically monitoring since pregnancy, then why not continue to do it for a little longer? Okay. When I say that I advocate assessing movements a little longer, I also focus on the fact that, if I start to do that early on, and if I pick some things early on, I would start the intervention for that as early as possible. Okay. Now, when I introduce and assess movement, I now introduce you to a tool called as general movement assessment. Okay. By now, I am making this very clear that, every child's occupation is to move, to explore, to facilitate the neurology with the experiences so that it matures to its fullest. Okay. Now, how do I, as a certified, and me, both of us as certified GMA assessors, help in this? General movement assessment, as the name suggests, it's about observation of how the child is moving. Now, when I say this, when I give you this information, isn't the child always moving? Yes. Isn't the child supposed to be moving always? Yes. Did you observe that your child was always moving, having a happy play all the time? Enjoying the happy play all the time. But what if that movement had certain markers that we missed on, which should have been caught up? And if we knew that early on, we would have facilitated the child, and probably, if you ever saw a delay in your child, it would not be there. Now, when do I do a general movement assessment? The most important thing. Okay. If I tell you that I have a tool that can assess the movement as early as 28-week gestation. By 28-week gestation, I mean that the kids who are born as premature as 28 weeks. There is a set of movement that I'm supposed to see at that age, which is absolutely okay and normal at that age. I'm supposed to assess as early as 28 weeks to a span of 5 months. 20 weeks. Isn't that a very good, isn't that a very good time span where, I just have to see the child at prematurity, if there is, at birth, if it's absolutely okay, and at a particular level where the maturity of the neurology just has to be checklisted, like around 9 to 16 weeks. Because, why do I say that I have to see this child 3 times? Because every child will show and has to show a different kind of movement at these 3 stages. At prematurity, it is absolutely okay for the child to be showing slow movements, being in a particular posture. It's absolutely okay. The child, remember, the child was still supposed to be in the womb and he is out. Getting my point? So when I say that, from prematurity to birth age, which is 40 weeks or 39 to 40 weeks of age, the child is supposed to show, maybe it's okay to have a slow moving baby, showing a slow dance of movement. But what if that slowness, that sluggishness of movement continues? Let me give you a glimpse of things that we observe at term age. Why would I say that at term age? Because yes, every child does not go through prematurity. It's not needed that, it's not compulsory that every child be born premature. So at 40 weeks of age or 39 weeks of age, what I need to see in a child is that slow, spontaneous dance that happens. I'm pretty sure you are mesmerized, and everybody of us is mesmerized by the way the child moves when he comes out of a swaddle. It's one of those precious things that we have always observed and we cherish if we get to see those smiles, if we get to see the movement and the dance that the child actually shows us. That is general movement of the child. Okay? It should have a smooth start, it should have a smooth end, it should involve all parts of the body. Subtly, you cannot even fragment if the shoulder started to move or the neck started to move, or if it elegantly ended up with the child taking the hand on in their mouth. All of these things I would call as fluency of movement. I am 100% sure that most of us have observed this in our children. Okay. Now, when I say that I have to see these things at term age, I also need to understand that, if this is seen, what else? I'm a greedy mind. I have a greedy mind wherein, I want to see more. I want to see the child. I want to see the child again, and I want to visualize how that child will be at a mature neurology. So I come back. I see the child at 16 weeks of age, between the 9 to 16 weeks of age, which is where I see a different kind of movement. Was there a difference between movement at birth age and at 16 weeks? Because, like I said, child's function is to move, to explore towards something functional. If at birth age I see the same movement in a child, and at 16 weeks of age also I see the child doing the same things, it's a marker then and there. Why? Why is the neurology not picking up on things? Why is the child not exploring? These whys are where we are. We need to assess the child for this period of time so that we pick up on signs that are important and that can help us achieve, or probably that can help us be the marker for, something maybe wrong. We are only here to find the maybes. Definitely wrong or not wrong is something we will leave the diagnosis, because, neurology will surprise us. Now, why I do advocate general movement assessment? There are three things in this. First, it's the most reliable tool. Okay, it has been proven to have 80 to 90% reliability. Again, I will stress on the fact that, GM assessments can happen over a span of 28 weeks gestation, day prematurity, to 4 to 5 months of age. That means it's a very big time span. So validity and the reliability of the test increases even more. A child can be assessed remotely. By that I mean, when I want to do a GM assessment, I don't want the child to be seen by me in the department. We don't need the child to come to us to the department. What we need is for you to give us a video of around 45 seconds to 50 seconds, a video where your child is not externally stimulated. Please do not show them toys. When you are giving us a video, give us the video when the child is awake, calm, wherein he is not crying or anything, and he or she is not externally stimulated. That is about it. Observing the child like this periodically will give us the necessary information wherein we tell you that if your child is at risk for something. And mind it, we would want everyone to be able to explore to the fullest and come out of the fact that, even if there is prematurity, there is a chance that my neurology has overcome. We want everybody to go towards what normal development feels. Yes. Now, when I say that, what do I see as the markers? What do I see as things that, can be, probably I will not use the word ignored, but do I have to give importance to these things? Absolutely. I will give you a key checklist or observational checklist for the family. Wherein, when I say at particular age or any age, okay, has the neck folding become mature? Okay, as and when you see your child grow, what maturity that we expect is the neck holding should become stronger. Every one of us. Where do the maybes, the faultiness comes in is that, is there a change in the neck alignment? Do I see my child being feeling stressed when he's doing the neck alignment, or sorry, neck holding for that matter? Is there something that you feel as off when it comes to neck alignment? Is he or she keeping his head to one side only? Is it like tilted most of the time? Does he need to keep the head in one particular position so that he can track better? Other markers. Is the eye tracking continuous or is it fidgety? Is it intermittent? Is there spontaneous rolling that I see after 3 months of age? Is there a social smile? Is there a spontaneous smile? This will show us, is the child able to emotionally bond, emotionally regulate, have the attachment with each and every family member? Again, coming back to movement, is there midline play? When I say midline play, it's okay. I have always seen children play with something in on their when something is placed on their chest. Is it sternness? Is it sternness for the child to actually get their hand together in midline? These are the signs which we need to keep as markers that yes, it was observed that the child is trying to, what do you say, is trying his level best to actually do the midline play. It should be smooth. It shouldn't be difficult. Now, is the reaching and exploration in the play gym limited? Yes. When you observe this observational checklist as a family, you will understand that you will know as instinctively that this feels. Now let's come to tummy time. We at the department are always asked about, is there a person doesn't like, my child doesn't like tummy time. Do we have a history of your children not liking tummy time? Yes, many of us will have that. But that's where we are at. Even if the child doesn't like tummy time, what is it that can be done? How can the child be facilitated to like, okay, or probably to work around it? That's where we do. Now, the most important thing as my giveaway in terms of, what GMA assessment feels like. Okay, even if you do not understand what GMA assessment feels like, these certain signs are something that we cannot ignore. Okay, first would be continuous twisting of one hand, child preferring to look at one side only, slow, sluggish movement. If I have to wait for the child to show me any movement, there is a marker. This may be something I need to work on. Prefers to keep the legs crossed. You will observe this during nappy changing times. That the child feels stiff, arching of the head and tummy and trunk. Sorry, arching of the head, neck, and trunk during tummy time, and resisting taking weight. These are the most important checklists that you cannot ignore. Let me give you an insight on our champion. This is Baby H. Okay, what we did and how Baby H is now. Okay, uh, Baby H was born 37 weeks. He had hypoxia at birth. Clinically, no established diagnosis. Had an NICU stay for 1 day. Okay, ECG, blood culture, EEG, blood culture, everything was normal. Now, our champion, we have been monitoring our champion since the day of birth. Okay, first 2 weeks. Then Periodically, he has been screened by us every week, so to say. Okay. The first thing that we saw next. Now let me show you our champion at 2 weeks and 3 weeks of age. Okay. When we did the assessment for our champion, as you can see, the child here is moving, and I am only talking about general movement assessment and movement, assessing the movement. But we saw the early markers. When I say that yes, the child is moving, but there are certain signs where I say that the child is moving, but he's showing us similar movement. When the child moves, he starts a particular flow of movement and sometimes it just abruptly ends. There are time spans wherein there is just no movement. The child waits for some kind of a stimulus and still does some movements that are a little repetitive. We picked up on these at 2 months or 2 weeks. Then we gave them certain interventions at that age itself. Okay. And we started some stimulations. And at 3 weeks of age, the movement is still a little repetitive, but the movement got better. There are a few videos which shows that he engaged, but still, as far as me observing some kind of a movement, sort of the flow was into the flow of movement was there. But he did show good variation. He was trying. He tried his level best to cope up with what we were trying to externally stimulate him. Our guidance was absolutely remote. I will tell you, our champ doesn't stay in Dubai. Our champ was observed remotely, periodically. Videos were sent to us. We were assessing it at every stage, finding the movements, trying to facilitate him. And then we decided that, baby H has to come to the center. We need him to come to the center for more clarity and for us to give him the intervention that he needs. Okay? Now, I'll tell you something. This is baby H at 3 months, 2 weeks of age. With just 1 week of holistic facilitation, we achieved as we observed that initially what we also saw that his midline play was limited. He would park his head to one side. Rolling was difficult. We also observed that there was fisting of one hand. Now, with facilitation at the department, holistically, seen by everyone, we saw that he picked up on the milestone and now so this is still last week. This week he is improved even better. So our champ is doing much better when it comes to the movement, the kind of a movement he shows now, and the ease with which he moves. Mind it, probably this would have been picked up by everyone, but The fact that they started so early, they came in so early, and we started everything in our power to help this champion. We achieved the milestone and we achieved it. This is where early intervention sets in. Do not wait for anything to happen. Start early. What do you say?
Absolutely, Nehal, and thank you so much for your detailed explanation about gender movement assessments and benefits of early screening. Now, after hearing about early screening, early diagnosis, what are the benefits? Okay, now we have picked up, but I would like to highlight now next what? Like the next question would be what is the next step? So the next step is treatment. The next step is intervening, and that's what we do in our department. So before I explain a little bit about early intervention, I just want to step back and talk a little bit about what we just saw in the video. We saw in the video that the baby had come to us. We identified the milestones that were missing for the baby for that age. We provided the child with repeated external input, and we saw the difference in 1 week that the baby on his own started doing the movement that is needed for that age. So what essentially happened? What is this process known as? The process is known as neuroplasticity. Now, what is neuroplasticity? Before that, I want to say about neurodevelopment. So our brain is an organ. It's an organ which I would say that we have a nature's gift. Like neuroplasticity is like a gift from nature. Now, what I'm trying to say here is that our brain has the potential to remodel, rewire, form newer connections in the first 1000 days of life or first 3 years of life. And this is like a golden period. Like I always say that this is a golden period in every child's life, that even if any child that is born early, like premature, preterm, so the child is already born with a immature neurological system, right? And or born full term but experience some birth trauma. So when this child comes to this world, they may require external input with like via early intervention programs, because but this child is also born with an intact healthy brain. Like even if a part of the brain that acquired some damage, the child is still born with a healthy brain, and this healthy brain holds the capacity to remodel, form new neuronal connections. But to achieve that, this child or these children will need external stimulation. And this whole process, to summarize this concept, what I tried to explain is neuroplasticity. And we saw a video like what exactly happens. Now, there is also a third thing that happens, and this I'm not sure if this word is very familiar to everybody, but there is a third process that happens, and that process is called as pruning. And what is pruning? Pruning is basically elimination, or pruning happens after nearly the child is turning 2 years, between 2 and 5 years of age. So essentially what happens is like, let's say example that this is our brain, and the brain has a lot of, like there are some rooms that are closed, okay, like some part of the brain that's not working, but there are still some open rooms, and that is waiting for stimulation, but external stimulation. And we are giving information, we are giving input, and we are making these strong connections, and the brain is picking up. Like the healthy part of the brain has the ability to take over the functions of the affected brain. But this happens in the first 2 years. But then if a child for some reason did not receive the diagnosis early and is near the age of 2 years, so the brain has already started eliminating the rooms or the pathways that were not used. Okay, so this essentially happens with everybody. But again, I also want to emphasize on one point, that it's not that if a child will come to us after 2 years or 1.5 year is not going to show improvement. The concept of neuroplasticity is applicable even today in our life. Like even at the age of 25, 30, 50, 40 also, we are learning new skills. But we all know that for us to learn a new skill or for a brain to rewire, or to form newer connections, we need more practice, we need more time, because we also, for any task that we want to learn, our brain also has something to compensate, right? So essentially, with our talk today, our mission basically here at Hope, or our department that we both work in, our mission is to emphasize on, our goal is to emphasize early screening, because we know that we see children every day in our clinic. That if I've seen a child at 3 months, 4 months, and I know, I'm confident that this child will be able to achieve his or her milestones on time, or for any reason, if a child has a very severe brain damage also, I still can help this child, because any brain damage that happens to the child is non-progressive. The brain damage doesn't progress, but the symptoms that the child has progresses. So we know that we can help in that part also. Now, with the availability of tools like general movement assessment, which is non-invasive, there is no anesthesia required. A lot of times, it is not required for the parents to come here. Like, in a lot of times, when an assessment has to be done, the child and the parent has to travel to come here, and it's difficult. If it's a new baby, a baby who has spent 2 months, 3 months in an ICU, it's difficult for parents to sometimes come. But what we are trying to say, that it is easy with this tool. We just need a video. And of course, if anybody reaches out to us, so there is a certain protocol that we follow, like in a certain way, that we need this video. And why we are advocating the need of early screening is not only to find physical symptoms, like physical delay in children. When we are seeing a baby, whether in the clinic or in the video, but in clinic, it becomes easier to identify other delays also. But when I'm seeing a baby, or we are seeing a baby when they come to us, like at 1 month, 2 months, 3 months, 6 months, 8 months, doesn't matter. Along with the physical examination, the tone, how baby is moving, if baby has head control, if baby is sitting, we are also assessing other systems of the baby. How the baby is hearing. Is the baby responding to sound? Is the baby tracking? Is the baby maintaining eye contact, like how my colleague explained in the initial slides? So now, if I know that the baby is physically developing perfectly fine, good, I'm happy, but the baby is not tracking. The baby is not responding to name. The baby is not responding to sound on one side. So then we know that this baby may require intervention through some other therapist. Like we have screening from other therapists. For screening, of course, because we are just picking up the signs, but we are not the expert in the field of speech therapy or occupational therapy. We have other experts that also in these areas of field also provide early intervention program in our clinic, who give early intervention if children show speech delay, we have early intervention program for children who have any sensory, in the sensory system, if there is a delay, right? So essentially, this is the message that we are trying to give. And
we would say that what Khushbu and I agree on is, when you say instinctively, what it is. Very nicely, she put it to me yesterday, where she said instinctively, follow your instinct. The mother.
Yeah, and yeah, right.
So I would want her to say that, because she said it very well.
Yeah, thank you, Nehal. So, what in so many years of our practice, and like my personal experience, I have seen that the first person, in 99% of cases, not even 90, I will say 99% of cases, the first person that actually notices a delay or there is something not right with my child is the mother. Like parents, but I would say the mother. And a mother's gut never lies. Like if a mother feels that there is something not right with my child, and of course the first person, they don't come to us like, okay, maybe now the awareness is improving and they may, and we are getting direct referrals also, like parents are directly booking and coming, but the first person, they go to pediatrician or family doctors, rarely neurologist. And a lot of times, like I'm not saying they're always discouraged, but in some cases they are discouraged, saying that the baby was born early, the baby came 2 months early, the baby has weakness, don't worry, wait and watch. And this wait and watch has to be an outdated approach now. Like it has to be outdated. All I'm saying is, okay, I hope the baby does not have a problem, but what we want to say is that if the mother feels or if a baby is born early, please come for screening, just come for screening or send us a video. It's not going to, it's, we just need a 2 or 3 minute video from you and we will be able to give you some answers, if not all the answers.
Yes.
Right? And it will ease off a lot of anxiety which moms or parents have in the initial stages.
Absolutely.
Right?
And you give us an insight on
yes,
success stories.
Yes, and we also want to show you some videos of our clinic graduates, of children who had come to us at 6 months, 9 months of age, and they're graduates. So when I say they're graduates, they don't no longer need therapy. So I will quickly show 3 videos. So the video is of baby M, and he was a micro preemie born at 29 weeks. He had spent 3 months, 90 days, more than 90 days in the NICU, and at 9 months of age, he was diagnosed with HIE, that's a form of cerebral palsy. And his first consultation was done at 7 months of chronological age and 4 months of corrected age. So, what I mean by that is that up till 2 years, when we are assessing a baby, up till 2 years, we are minusing, we will minus or we will correct the age, adjust the age according to the week the child was born, and assess the milestones for that particular age. So now this baby, when he had come to me, I will assess him as a 4 month baby. So in the initial screening, I had seen the baby had no head control. He was not turning on either side. He was finding it very difficult to even sit with support. And he absolutely disliked or hated being on his tummy. Like the mother said, even for a minute, it used to be difficult for her to put the baby on tummy because the baby also had reflux, and reflux also is one of the major reasons why children don't like tummy time, and that also needs to be picked up early on. So this is the video, one of the first few sessions, or maybe the first or second session that we had done for him. As you can see that he was struggling to, first of all, he was not accepting my input, and it is very normal. Initial few days, children will resist because, especially children who spend time in NICU in the early weeks of life, they have been tubed, they have their early experiences are not very good, enriching. So, any external stimulation later, also, children do show some resistance, and within few weeks, they normalized, like the bonding happens between therapists in most of the cases. And this is the video that I will show you, was taken when the child was nearly 24 months corrected age. This was from his second birthday. The mother had shared the video, but at this time his corrected age was 21 months. The child had achieved walking when he was 20 months corrected age and 22 months chronological age. And this is a video that was shared after he was discharged from the therapy. Now you can see him trying to come down from the slide at the end. And the second success story is of baby S, and she was also a premature baby. She was born at 30 weeks. She essentially had spent also 2 or 3 months in the NICU. And at 9 months of age, she was diagnosed with PVL, that is also a form of cerebral palsy. And when she had first come for screening at the clinic, her corrected age was 6 months, but her chronological age, like from the time of birth, her age was 9 months. And that's when she was diagnosed. And that is when actually, by then, the parents had got more alerted because what I clearly remember my assessment with the parents when I asked them that why you didn't come early, for screening. So I remember the father telling me that, I mean, we thought the baby was born early. She spent so many days in the NICU, and we were told that, she is weak, okay, and she will show some delay. And it is okay if the child shows some delay, but if a child at 6 months or 9 months of age is just preferring to lie flat on their back and only has achieved head control, it is not okay. So when she had come, yeah, as I mentioned that the only milestone there were two things that I'd observed. The child only had a head control, and she was only rolling. I mean, I would say turning from one side. From left, she was just going on the right side. And otherwise, the activities that she should be doing for that age, she was not doing. Like there was no midline play. There was she was not able to prop her pelvis up. Even she used to dislike being on the tummy. She even with support, because at 6 months child can sit alone. She was not able to sit, and yeah. So I will also show you her video, which it's a compiled video which I have, where we have some clips from the therapy sessions and some clips comparing clips of her milestones achievement. And the second picture that you can see on the slide is it's from our last session. I could say it was a graduation day from the clinic. It was a picture. I didn't even know the mother had clicked this picture because I was so happy that, of course, we miss all the children, but we are so happy when we are able to discharge a child and say that, this child no longer needs therapy. Like this is that moment that was captured. Uh, and the third video, before I play the video, I want to mention a little detail about this child and a little different intervention that we had done for this child, because this child came to us when he was exactly 1 year old. I remember I assessed him in June 2021 on his birthday. Like on his birthday, the parents brought him for assessment. And my first question to parents was, why are you seeing a therapist or doctor on his birthday? Because that's when it kind of, the mother became more frustrated, where it's the first birthday and the child is not sitting, the child is not doing anything. Like imagine at first birthday is when this happened, and this child was on regular doctor clinic visits, everything was going on, but the mother told me that they were not really encouraged, because this child is not from Dubai also, they are from a different country, I don't want to mention, and they were not guided about therapy. Their mother didn't even know that there are therapies that exist. But thanks to social media, nowadays everybody has accounts on Instagram, Facebook, YouTube, and the reach and awareness is improving. That's when one of the days she came across our clinic's video, and then she saw some babies video and she felt like, okay, let's just go and check. And that's when they had come. And the first time when I saw this baby, you will see when I play the video, the baby was doing nothing. The baby just had a feeble head control. The head control was also not strong because the baby was already 1 year old, and the baby was not turning, no head control, no sitting, nothing, like absolutely nothing. And for this child, initially the plan that we made was, because we had to work through a lot of things, like 1 year of work that we had to done, and I didn't want to miss out on the golden window of those first 1 year, 2 year period. I suggested the parents to undergo an intensive program. An intensive program is a little different from the regular therapy that we offer. So what exactly we do is we give 3 weeks off intensive therapy to the child, where otherwise we will, when we first time see a child, we will call the child 2 or 3 times a week, give home program, and then they come to the clinic 2 or 3 times. But in some cases, where we want to bridge this gap faster and we want to make use of this concept of neuroplasticity and the time, we sometimes suggest intensive programs. So we saw this child continuously for, I think, 2 weeks plus. My suggestion was 3 weeks, but I think the baby had fallen sick also in between. So around 2 weeks plus, I was seeing this child 2 times a day for 1.5 hour to 1 hour every day. And the result, I will show you what we achieved in a span of nearly 2 months. Uh, Now this child is walking and he has achieved all his physical milestones. Unfortunately, they had to go back to their home country, but the mother was in touch through videos because they came to us and she learned, and she was a very diligent mother who was totally hands on. And actually, all the parents are very hands on. All that today, what I showed in this video, is not our credit. It is not at all possible without parents intervention. It's not possible just by seeing the child 2 times 3 times a week. It is all the hard work that parents do when the program that we give to them and they follow. This is all the hard work. This is a teamwork. This is not only our work. And with this, I we are at the end of our presentation, and I just want to share one quote by Neil Tyson, that everything we do, every thought we ever had, is produced by the human brain. But exactly how it operates remains one of the biggest unsolved mysteries. And it seems the more we probe its secrets, the more surprises we find. And I hope with this presentation today, we were able to solve some of the mysteries or questions the parents have. And we are so grateful to all the attendees, to all the parents that took out their time to come and attend this workshop, who patiently listened to everything that we wanted to explain. And we want to thank our clinic, Hope, that is helping us in our mission in spreading the message of early screening and early intervention, because we are very big advocates of like big time advocates of this program. And our
As a
group,
token of gratitude.
yeah, our group, Small and Mighty Babies and Twin Plus Arabia, as a token of gratitude from us and our clinic, we want to offer a free newborn screening from all the parents belonging to these both groups. Okay. Uh, Thank you so much. And if there are any questions, we are happy to answer. Thank you. Thank you, Ms. Suman. Thank you, Ms. Vritti Segal. Thank you.
Thank you.
Uh,
Thank you.
Thank you. Thank you, Ms. Lala.
Thank you.
We will be sharing the link of the presentation, and will be available on our Facebook page and our Instagram page, and all the registrars will be receiving a link of the program. Miss, sorry, I cannot pronounce your name, but is it better to bring the baby to the clinic? Can you tell me how old is the baby? And do you stay in Dubai? Okay, the baby is not born yet. Okay, okay. So how many weeks are you in your pregnancy now?
We can surely guide.
Yeah,
we can surely get in
yes,
touch.
We
sure.
can get in touch after the
Yes.
baby is born.
Now, this is something that astonishes me, and I, in a very good way. Like like as a mother, you are trying to tell us that my child is not yet born, but I want to get the screening done once it happens.
Yeah.
That shows that I'm so happy. I'm glad that whatever we saw and whatever we said today, it actually fell into it's like it's a feedback that we would want. Yes, it's a feedback that I want to get my child screened. Thank you so much.
Miss Naigan, what I'm trying to say is that let the baby be born, and hopefully you have a healthy pregnancy and you deliver the baby full term. And
We will
40
connect
weeks,
with you.
yes. And if you feel anything, you can get in touch with us. You can share the video of the baby once the baby is born. Like
Just reach out to us.
Yeah.
We will be here to guide you. Do
Yes.
not worry about it.
Okay, thank you. And with this, we come to the end of the presentation. And thank you very much, everyone.
I want to express gratitude.
Yes, thank you so much.
Extreme gratitude to the parents and the family of Baby Edge and our champion for sharing these videos so that it is informative for
Yes.
everyone. Thank you.
Thank you. Bye.